I don't know why she's acting like this, but we have to calm her down to get her out of here safely.
What are you injecting here?
This gentleman's addiction has clearly taken a hold of his life.
Based at 1867 calls remaining in Alpha for 51-year-old female household psych issue. Be advised that patient could possibly be violent.
Thank you. She's probably off of her pills.
We usually approach psychiatric patients a little bit differently. We're not sure if they could be violent.
I don't see anybody outside.
Oh, there was someone on the ground there.
When responding to psychiatric emergencies, there's so many factors that remain an unknown. It could be pre-existing, could be mental illness, it could be induced by drugs or alcohol.
What's going on? Sorry? What's happening? Let's sit up. Let's talk to you.
Did she do any drugs tonight that you know of? No?
Can you sit up?
I'm right here. Deal with these people now.
Can you sit up for us?
Has she been drinking?
Yeah, she had a couple shots of whiskey and she shouldn't have had it.
This patient seems very agitated for only having a couple shots of whiskey. It is possible there's something else going on.
I need you to tell me what's going on. Why you need to go to the hospital. Depression. Do you take any medicine?
Yes.
It's difficult to obtain accurate information on these calls, so it becomes hard to treat the patient.
We're gonna stand you up and put you on our bed.
Let's lift your head here.
We're unable to calm her down by talking to her, so we're gonna have to sedate her.
You didn't see her take any drugs?
No, I didn't.
None at all. Does she have a history of doing drugs in the past?
Keep your hand in.
Does she ever do like meth or cocaine?
No.
Nothing like that. No. What about narcotics or downers?
No.
Guess what?
Okay.
You're in the ambulance. You're not going.
Don't put me.
Okay.
We're gonna check her out a little bit more in the back of the ambulance, and then we'll take her to the hospital. Here.
When she's in this kind of a state, she becomes a danger to not only herself,
Don't pull on that.
but to myself and my partner as well.
Help me.
The best thing we can do is give her a little bit of medication to help calm her down on the way to the hospital.
Okay, little poke in your arm.
Ow.
These calls are always challenging. I feel that we deal with a lot more mental health calls now than we ever did in the past.
Lower her on my goddamn heart. She's got some issues.
Roll her. 1, 2, 3.
How do I deal with it? I don't. Because I love her.
We'll call her. I'll grab one. And
So this lady has some mental health issues diagnosed. I believe she spent some time in a psychiatric facility. Tonight, she's been drinking, doing some unknown drugs, and that's just exacerbated her mental health issues.
It's tragic when people suffer like this.
Tom, St. Paul's. We're gonna head out.
We're just thankful she didn't hurt herself or anybody else tonight.
I don't feel bad here.
Okay.
I can't breathe.
How long is a little while ago?
What are you injecting here?
This gentleman's addiction has clearly taken a hold of his life.
Base to 67. You're responding Delta for a 55-year-old male, having chest pain, not breathing normally.
.55 male with chest pain.
First thing we need to figure out is this cardiac related, or is this more of a muscular issue that he's having?
I haven't tried the door yet. You got those gloves?
Call an ambulance? Hello? Can we turn on some lights? Can we turn on some lights?
I need an ambulance.
Let's just find these lights. Okay, sir, what's happening today?
I had a bad accident there a couple of days ago.
Can I check your heart rate there? I just want to feel your wrist. Okay, you said you were in an accident?
I did a little while ago there. Like I hurt myself real bad here.
Okay.
I don't know. I can't breathe.
How long is a little while ago?
Amazing.
So as we meet the patient, I start to kind of take a look around the apartment.
You got bugs crawling in your apartment all over the place, eh? We can see bugs on the wall, on the ceiling, on the floor.
Bugs everywhere.
There's movement on the floor around the garbage can. and there's movement that's going across the ceiling.
BB's in here, let's go.
I'm an IV user.
You're an IV drug user?
What are you injecting here?
Dilaurid's a form of an opiate, kind of like morphine. It's very good for pain control, but it's also highly addictive.
Don't touch any of that.
Let's get you outside. Yeah, grab your keys. Let's rock and roll.
This gentleman's addiction has clearly taken a hold of his life. He started to neglect everything else.
So he's saying that he fell off his bike a couple days ago, just a pedal bike, and he's got some pain to his ribs.
Sorry, that hurts, that little bit of pressure?
How did you get started on your Dilaudid, Richard?
That goes back from 1982.
What happened in '82?
I fell off a roof. I used to be a roofer.
Turns out that about 20 years ago, this guy had a serious work accident and has since become addicted to opiates.
So I used to just pop it. But then I found out it's faster than...
Inject?
Yeah.
He needs some help. With luck, he'll be able to get that treatment and get his life back together.
Have you talked to your doctor about the methadone program?
I don't want the meth. I'd rather get sick. How long are you going to be sick for? 3 days?
How long have you been using for?
20 years.
Yeah, 3 days isn't going to cut it. He seemed pretty sincere that he wanted to quit his addiction once and for all.
I'm going to beat this.
I think you will.
I'm going to.
It sounds like you're ready to be done.
I am. I want to stop.
Can we stand up? Give me your hand. No?
No, I'm not gonna do anything. I'm not gonna fight you. I'll leave you alone.
Relax.
Base to 23. This is an echo response for a 31-year-old female patient. She's taken an overdose. She is unconscious, not breathing.
We roll up on scene to find city police standing over our patient on the sidewalk. Flashlights on her. Nobody's doing CPR at that time.
Hi. Can you look at me? Look right at me.
So she's looking past me like there's nobody there, just staring off into space.
Look at me.
And as I bend down to feel her wrist and her pulse, I would expect it to be a little bit fast, but it's not.
Just spaced out on something here. Oh, yeah. Can we stand up? Can we stand up? Give me your hand. No?
She got woken up abruptly because people were concerned about her.
Can you stand up?
And there's hands grabbing her and people are telling her what to do.
Why didn't you go to the ambulance?
Well, you're laying on the ground.
Like, no joke, she wasn't breathing. And like 2 or 3 pumps of CPR and she's
Yeah.
like, what the?
Yeah.
So, I don't know, it just kind of came back after that.
Okay, no, I'm not gonna do anything. I'm not gonna fight you. I'll leave you alone.
Relax.
It's not uncommon for somebody who is intoxicated on drugs or alcohol to become extremely agitated.
Leave me alone.
Hey. You gotta stay on here, okay?
I'm not gonna fight all of you.
Okay.
Leave me alone.
Please, okay?
I just want to get you.
Did I ask for help? No, I didn't.
Hey, calm down for us.
Then you have no right.
Hey. No.
I can tell that she's scared, so speaking to her calmly and reassuring her is important.
We don't care about those things. We just want to help you, okay?
Can you at least ask me to grab my hands?
Okay.
I will give you my hands willingly.
Okay, we're gonna let go, okay?
And also letting her have some sense of control is really important.
Get him away from me.
Say you're sorry, okay?
Get him away from me.
Patients develop this irrational dislike for paramedics all the time,
Get him away from me.
We're gonna go in the back of the ambulance,
The
okay?
ambulance, okay?
so you have to have a thick skin and not take it personally.
Just don't flail around. Get him away from me.
Do you wanna-
I hate you. Don't talk to me.
Hey. There's no need.
I respect
Drugs and alcohol make people think really irrationally, and sometimes people don't like you when they're on drugs and alcohol.
Get her away from me. I don't like her.
Hey.
I always try and remind myself to treat people equally. I don't have to agree with people's life decisions, but I still have to respect them because we're all just people and we all deserve to be respected.
Can we take your blood pressure and your blood sugar?
Not until we're on our way.
Not until we're on our way. Yeah.
With this patient, there's probably a deeper issue going on. Maybe she feels marginalized. Maybe she feels like she's had some negative experiences with first responders. But at the end of the day, we're genuinely here to try and help her.
This was a 911 hang up. Code 8 does have a call in. Before she hung up, it was a female patient on the line stating that she was seeing ghosts.
Seeing ghosts should be on your side, first house.
White one right here, maybe?
When we get a call hearing that somebody's seeing ghosts, two things come to mind, and that's either pre-existing psych issues or drugs.
Oh, yeah. Front step. Talking on the phone.
Hey, 21 us there?
Do you want to come this way, dear?
It's dark, it's night. This is the call where your scene survey is very important. We initially see one person, but we don't know she's the only person, so being aware of our surroundings is important for our safety.
What's your name? Where do you live?
A lot of the times when we're present, a lot of people kind of keep things in, especially if they've been doing drugs. It's frustrating because I can't help you if you're not telling me exactly what ails you, kind of thing.
Have you done any drugs tonight, dear? What did you do? What, cocaine? Okay, and what about any alcohol? You were drinking too, hey? How much were you drinking? You drank a lot. Whiskey, hey? Okay. Who lives here? Okay. And how'd you get here?
They gave me a pick me up, and they basically left me on their front porch to bleed to death.
To bleed to death. Can I see your cut?
You know what you cut it on there?
You know, most people with a lack like that will just go, like, they won't even call us. I guess there's nowhere else to turn.
I'll tell you what. How about you come to the ambulance? We'll take a look at it where there's more light, okay? It's tough to see out here. Well, she's got a small lac on her hand. I don't know how she got it.
Right.
How did you get the lac on your hand? Did you fall? Were you pushed?
Into the window.
Pushed into the window at this house?
No, in the back.
At the back of this
in
house?
In this house, at the back.
Okay. Well, just come.
Oftentimes, in these situations, these patients don't always tell us the whole story.
They kind of want to make it seem like they did nothing wrong, or they want to hide something. She took drugs, and you know, maybe she's thinking, well, now the cops are here, I'm going to get busted with drugs, or are they going to charge me with vandalism or whatever?
I mean, no.
IV drugs? And do you want me to check your blood pressure again? Okay.
Well, emotions are high, she's getting into a fight with her friends, but she's on cocaine. And it makes it really hard talking with somebody when they're on that. She never could clearly explain why she needed help.
Deep breath, okay? Which house is this? Do you live here? Whose house is this?
She just couldn't give us a straight answer.
You can just answer our questions.
You're not in trouble, you're just trying to make sure you're okay, because once you leave here, I want to make sure that you're going to be okay.
I don't know why she's acting like this, but we have to calm her down to get her out of here safely.
Base to 27. Code 8 is on scene with a 19-year-old female. She was taking an overdose on an unknown substance.
You should be able to see Code 8 as you pull up.
There's Code 8 right there.
Code 8 is our radio term for Saskatoon City Police. As we arrive, we see multiple Code 8 vehicles on scene. It could potentially mean a lot of things. It could be a dangerous situation. There could be weapons there.
Yeah, there's a door here. Just a lot of commotion going on.
Before we get to the front door, I can hear the patient screaming.
Hi there.
So immediately I know that there's a situation going on that's completely out of control, and we're gonna have to figure out a way to get control over this.
What's happening?
A female who is definitely on something. She is losing her mind.
Is she kind of a harm to herself, do you think?
When you can hear somebody screaming like that from the street, before you even get to her, you know her level of agitation is extremely high.
It kind of is that blood-curdling kind of scream that makes the hair on the back of your neck stand up.
It's an extremely tight space. She's face down on the floor. There's a cop on either end of her holding her down.
Mental health history, bipolar, depression, anxiety.
Hush. The only way that I can physically give this patient an IV is to sit on her legs and have police officers on either side of her holding her down.
Have you ever seen her act like this before? Any allergies?
Not that I know of. I know when she drinks liquor, she has a reaction.
What about drugs, street drugs?
You didn't let me die.
I'm gonna give her some medicine in the arm. It's gonna calm her down, and then she'll either walk out of here or we'll carry her out of here. I don't know why she's acting like this, but we have to calm her down to get her out of here safely because I don't want her to get hurt, okay?
We're at the point where, regardless the nature of the hysteria, we're gonna have to sedate her to transport her to the hospital. There's just no other way to do it at this point. I don't want to sedate her so much that she's laying flat on the floor and now we have to breathe for her. But I want to give her just enough that she's calm and we can walk her out of the house.
Okay, so I've given her some medicine to help calm her down. You can tell she's not screaming so much.
All right, babe. Just us girls here. Calm down. Slowly breathing down.
We'd like to walk her out of here and take her up to University Hospital. Did you want to come with us?
I can't.
Give us a minute to get her onto the stretcher maybe, and then you can change.
Where's my mother?
She's here.
Oh, look at my boy.
I think I broke my glasses.
Gonna give her another 2.5.
How much total?
No!
She said
This
5.
needs a higher dosage. Give me a higher dosage. She needs a higher dosage.
It's tough to stay neutral when somebody spits on you like that. You just can't take it personally. She was kind of out of options. Her hands were tied, her feet were tied.
Okay, watch your feet.
It's not my job to judge how she got here. There's lots of things that she could be dealing with in her life. It's my job to help her.
What's happening?
On a psychiatric emergency call from earlier in the night, this patient was transported to the hospital. She was assessed, observed, and later released.
Our patient earlier tonight with the chest pain,
I know everything is showing that you're having some kind of muscular pain.
he went to the hospital and was given a chest x-ray and a further cardiac workup.
The patient is doing better now. He says he wanted his story told so that others know calling for help is the right thing to do.
We don't care about those things. We just want to help you, okay?
And Gabby is pursuing a new career path. We wish her all the best.
This young woman has admitted to drugs and alcohol, and I feel that she's called us because she doesn't know where else to turn. She's transported to hospital. She was treated, observed until she was sober, and later released.
The patient that we picked up earlier in the evening, I'm just glad that we got her out of the house safe, as well as the rest of us. I think I broke my glasses. Unfortunately, we see this a lot. She could be a nice, normal person on any other given day, but when she decides to take drugs, this is our outcome.